Thank you, and thank you to all of you for joining us today. In today's webinar, we're going to begin by summarizing what we feel are the key takeaways from the information we're going to present. Then we're going to provide a review on what influenza is, and specifically how it differs from the common cold. Then we'll look back at last year's flu season and talk about what experts are anticipating for the 2015-2016 season. Then we'll cover tips for prevention that can help protect you and those who use your facilities from the flu. And then we'll have some summary comments, and we'll close with some time to respond to any questions that you type into the Q&A panel. So let's begin with a quick review of the key takeaways, which are 6 steps to minimize the risk of catching the flu. The 6 steps are, number 1, frequent hand washing to prevent your hands from playing a role in the spread of the flu virus. Number 2, avoiding others who are sick. The flu virus needs to spread from an infected person to a susceptible host, so if you're not around sick people, you can't get sick. Number 3, being sure to clean and disinfect surfaces. Just as hand washing prevents your hands from playing a role in the spread of the virus, cleaning and disinfecting surfaces prevents those surfaces from playing a role in the spread of infection. Number 4, getting vaccinated. Get your annual flu vaccine either through the shot or the nasal mist remains to be one of the best preventive steps that you can take. Number 5, if you're sick, be sure to cover your mouth and nose when you cough or cough into your elbow to protect others around you. And lastly, number 6, if you're sick, stay home. Do your part to limit the chances that you'll infect others. And so with that, I'll turn it over to John to provide an overview of what influenza is and what the past few flu seasons have been like.
Thank you, Hank, and I'm pleased to be with you today to discuss influenza, a viral disease that sickens millions and tragically kills thousands of people each year. So I'd like to share some facts and statistics about influenza, but before I do, I'm often asked the question about the difference between colds and the flu. While they're both respiratory illnesses caused by viruses, the flu is caused by the influenza virus, while the common cold can be caused by one of over 200 different viruses. It can be very difficult to tell the difference between a cold and the flu, but the last 2 points on this slide provide some distinguishing characteristics. Another question that I'm often asked is the difference between seasonal flu and pandemic flu. An epidemic of pandemic flu occurs when a non-human influenza virus gains the ability for efficient and sustained human-to-human transmission and then spreads globally. For both seasonal and pandemic influenza, the total number of people who get severely ill can vary, but the impact of pandemic flu tends to be higher. The last pandemic flu was in 2009. In terms of similarities, the points on the left-hand side of this slide summarize them well. And I think I've covered the points on the right-hand side during my description of pandemic influenza. So let's get back to seasonal flu. The flu is a viral infection associated with fever and respiratory complications. Over 60 million people in the U.S. get the flu each year. Approximately 200,000 people are hospitalized, and tragically, anywhere from 3,000 to 49,000 people die in the U.S. from flu-related complications. 90% of seasonal flu-related deaths and between 50 and 60% of flu-related hospitalizations occur in people 65 years or older. This next slide provides some additional information on groups that are most susceptible to the flu. For example, 90% of flu-related pediatric deaths occurred in children who were not vaccinated. Children account for about 20,000 of flu-related hospitalizations in the U.S. each year. Adults, 65 or older, account for about 90% of flu-related deaths, and as I mentioned earlier, between about 50 and 60% of flu-related hospitalizations. I think many, if not all of us, can relate to flu symptoms. They include fever, myalgia or muscle aches, headaches, non-productive cough, sore throat, and nasal inflammation. I've also noted additional symptoms that children can get. In regards to when a person is infectious, it's typically 1 day prior to showing the symptoms and up to 7 days after symptoms appear. The sneeze that I showed earlier reminds all of us that the flu infects us through droplet transmission. This infographic on the right-hand side shows how easily the virus can pass from person to person, either directly through touch, indirectly through contaminated surfaces and objects, and through the air over the distance of 3 to 6 feet. And while this infographic shows the path of flu transmission in a school setting, the same model can apply in your work setting as well as in your home. So with the model of infection in mind, how long does the influenza virus survive outside the host? Virologists tell us that it can survive on hard surfaces like stainless steel and plastic for up to 48 hours, and on soft surfaces for up to 12 hours. It can survive on hands for about 5 minutes. And while that sounds pretty encouraging, only 5 minutes, you just don't know when you've touched an influenza-infected surface. So let's briefly take a look back at past flu seasons. This histogram is the result of the U.S. Centers for Disease Control asking the question, when is the peak of flu season? The answer is any time between October and April in the U.S. Almost half the time over the last 35 years, peak flu activity was in February. So let's specifically look at last flu season. This is a flu chart that CDC updates on a weekly basis, and it shows that for the 2014-2015, flu season peaked in late December and early January. As to the upcoming flu season, public health officials can't really predict its severity this early into the flu season. However, I can tell you that their ongoing influenza surveillance enables the U.S. CDC to, 1, predict the strains of the flu that are likely to be circulating this coming season, 2, design what they believe will be the most effective vaccine, and 3, it enables the CDC to inform all of us, the general public, when the flu becomes that seasonal epidemic. So at this point, I'd like to turn it back over to Hank.
Thank you, John. So, as we've said, the best solution for flu is to protect yourself from ever getting sick in the first place by reducing the chance of virus transmission. A first critical step in that prevention is proper hand washing. Our hands are the things that we touch everything with, so if we touch a sick individual or touch an object like a tabletop that a sick person may have coughed over, and then later itching your eye or touching your nose or mouth is a great example of how the virus can be passed between people and objects. In order to break that chain of transmission, you need to be sure to practice frequent hand washing with proper procedures. And by proper procedures, we're not talking about the splash and dash either, where you quickly rinse your hands under water and then run out of the bathroom. We're talking about proper hand washing procedures as recommended by the U.S. Centers for Disease Control and Prevention, which include first wetting your hands with clean running water, then applying the soap, then lathering the soap by rubbing your hands together, taking care to wash the palms, between your fingers, the back of your hand, under the fingernails, etc. Basically doing a very thorough job scrubbing all the surfaces of your hands. And the CDC also recommends that this process take at least 20 seconds to complete, or about the amount of time as it would take you to hum Happy Birthday twice. Once you finish the scrub, you then want to rinse well under clean running water and then dry your hands with an air dryer or a clean towel. The CDC also recommends the use of an alcohol-based sanitizing hand rub, what you might call a hand sanitizer, if soap and water aren't available. An important note here is that prior to use of an alcohol-based hand rub, your hands must be visibly clean. If there's visible dirt or soil, you need to remove it by properly washing with soap and water, as the soil could reduce the effectiveness of the sanitizer. And you should only use an alcohol-based hand rub if your hands are visibly clean. That's a point we really want to stress. The best way to apply hand sanitizer is to apply the product to your palm and then rub your fingers together until dry, such that the product covers your palms, your fingers, and the back of your hands. Basically, being sure to do a thorough job to ensure that the product contacts all of the surfaces of your hands. When you're using a hand sanitizer, you need to be sure to use enough product such that it takes about 15 to 20 seconds for your hands to dry. If your hands are drying a lot faster than that, then there's a really good chance you're not using enough product and you might not be getting the sanitizing effect that you desire. In addition to hand hygiene, we also need to be sure to clean and disinfect surfaces to prevent their role in the transmission of the flu virus. Cleaning and disinfecting of surfaces is a very important step to reduce the number of microorganisms, including the flu virus, that could be on the surface. It's a key step to reducing the potential that the next person to touch that surface is going to pick up a virus particle and then infect themselves when they touch their mouth, nose, or eyes. Just as with hand washing, proper procedures in surface cleaning are very important and critical. Remember, you want to clean and disinfect the surface. While we can clean without disinfecting, we can't disinfect without cleaning. The first step is to make sure that the surface is clean of any visible soil, because any organic matter or visible soil on the surface could potentially inactivate the disinfectant or protect or shield the virus particles from the disinfectant. So if you see visible soil, you need to clean it and remove it first. One option for doing that is to use a combination disinfectant cleaner product for both the cleaning step and the disinfecting step. You can tell if your product is a cleaner disinfectant by reading the product label and looking for terms such as one-step disinfectant cleaner. I want to emphasize the importance of reading the product label because it's probably one of the most important steps you can do when you're using a disinfectant product to help ensure that you're using the product correctly. In the United States, disinfectant products are registered and regulated by the U.S. Environmental Protection Agency, so you want to be certain to use a product that has an EPA registration number on it. You also want to look to make sure that the product has claims against influenza, and you can find this in the section of the product label that lists what organism the product is effective against. And when reading the product label, looking for that EPA registration number when you're looking for that influenza claim, make sure you read the section that covers instructions for use to ensure that you're using the product properly. As with hand washing, it's that proper product use and proper cleaning procedures that are going to be important to make sure the efforts you spend cleaning and disinfecting are actually effective in helping prevent the transmission of the flu virus. So in addition to proper cleaning and disinfecting of surfaces and proper washing of hands, there are other steps that you can take. As mentioned before, for the flu to be transmitted, the virus has to go from an infected individual to a new susceptible person who can then become infected. You can reduce the risk of this sort of transmission through social distancing by staying home when you're sick and by avoiding others who are sick. Also, if you are sick, it's important to cover your nose and mouth when you cough, either by using a tissue or by coughing into your elbow. Coughing into a tissue or into your elbow is going to help trap those virus particles and prevent them from becoming airborne. And lastly, make sure you get your annual flu shot, because vaccination remains the best protection in preventing yourself from becoming infected with the flu. So with those 6 prevention steps in mind, what are some of the steps that you can take now at the very start of the annual flu season to help protect yourself and your employees and those other people who are using your facilities? And before I get into these recommendations, I want you to keep in mind that these recommendations are targeted towards building owners, building managers, supervisors, people who are in positions to help implement these recommendations. As we go through these, if you feel you're not in a position to implement these recommendations within your facility, I'd encourage you to share these tips with someone in your organization who can. So starting at the top, with respect to hand hygiene, it's really important to make it easy for people to do. If it's easy, people will do it. This starts with making sure your facility provides products that are gentle on the hands, especially because of the repeated use from frequent hand washing and hand sanitizer use. Nobody is going to want to use a product on their hands that's harsh and leaves their skin dry or cracked. You also want to consider placement of product, especially for alcohol-based hand rubs. Place them in places that are easy and accessible for people in your facility to use. There are plenty of studies that have been done that show that if products are easily accessible and available, they get used more often. And with both hand soap and hand sanitizer, you want to make sure that the product in the dispensers stays stocked, because nobody can use them if the dispensers are empty. Moving on to cleaning and disinfecting. With respect to cleaning and disinfection of surfaces, you want to work with your cleaning staff to establish a frequency for cleaning tasks and provide them with guide cards that clearly show those high-touch surfaces, those objects most likely to be frequently touched by people in your building. You want to provide them with guide cards which show which surfaces those are and provide guidelines for how frequently they should be cleaned and disinfected. And with both of these, you want to make sure to advertise and promote these steps within your facility and provide reminders to people about the importance of hand washing and of cleaning and disinfecting surfaces. In our work, we found that customers and staff and people who use buildings are receptive to overt signs and messages that cleaning is important and an important step in keeping their environments clean, safe, and healthy. They really do appreciate these reminders. Moving on to vaccination, you want to make it easy for your employees to get vaccinated. For example, our company, Ecolab, provides an annual flu shot clinic held on-site and held during the workday as a way to make it easy for our employees to get vaccinated. Additionally, you want to find ways to make it low or no cost, such that cost is not a barrier to vaccination. Most health plans out there will cover preventive services such as vaccination in full. And it's also helpful to advertise and promote getting your flu shot and promote any flu shot clinics that are held on site through posters and other promotional materials in your workplace. For example, our company does this through email campaigns to employees and also posters placed throughout our campuses. With respect to social distancing, as an employer, you actually have a lot of influence over this through your sick leave and attendance policies. You don't want sick employees coming to work, as that makes it more likely that they're going to transmit the flu to other coworkers. So again, you want to advertise and promote your policies so that employees know that it's okay to stay home, and in fact that they're proactively encouraged to stay home when they feel sick. Lastly, with respect to cough etiquette, you want to make people aware of proper cough technique. The image shown on the right here is an example of a poster that Ecolab makes available to our customers for display in their facilities. It shows how to properly cough into your elbow or into a tissue instead of onto your hands, and then reminds people to properly dispose of that soiled tissue and then to perform hand hygiene at the end. So these are all steps that you can take and can implement within your facilities. But when you start doing that, you might have the question of how can I get some help in implementing them? So one thing that we would encourage all of you to do is to reach out to your suppliers, reach out to your vendors, and see how they can assist you. Your suppliers may be able to provide you with flu prevention information, including education materials and promotional materials reminding facility users about important things like hand washing and coughing into their elbow. Your vendors can also help you select hand care products that are going to be gentle on hands, as well as solutions, dispensers, and tools that can make hand sanitizer accessible and easy to use by building occupants. We've also found through our work that engaging graphics that communicate the importance of good hand hygiene can be helpful as well. And lastly, asking your suppliers to provide training and in-services can be a good way to get an outside resource to come to your facility and provide educational training for your staff, for the students if you're a school or a higher ed facility, to your residents and or your building tenants. So I'd encourage you not to be shy about asking your vendor partners to help you proactively work to communicate the message and help prevent the spread of flu within your facility. So now that we're coming to the end of our prepared slides in our webinar, I'm going to turn it back to John for a couple of closing comments.
Thanks, Hank. So in my closing remarks, from a public health point of view, more than 60 million people in the U.S. contract the flu annually, resulting, as I mentioned earlier, in about 200,000 hospitalizations and thousands of deaths. It has been estimated that influenza leads to about $7 billion in costs related to sick days and lost productivity, and about 200 million days of diminished productivity. And as a closing reminder, there are several ways that you and your staff can reduce flu infection risks. And they are: wash hands frequently and use alcohol-based hand sanitizer, avoid others who are sick, clean and disinfect surfaces, get an annual flu shot, cover your mouth and nose when you cough, stay home when you're sick. Back over to you, Hank.
Thank you, John. And so we wanted to include some information here, as many of you are Ecolab customers, about how we're positioned to help you. We at Ecolab, we pride ourselves on the personally delivered service and support that we provide to our customers every day. And as part of that commitment, we work to ensure that we're well positioned to help you in your own annual flu campaign. We do this by offering several EPA-registered disinfectant products that are effective against the influenza virus. We also offer a variety of hand hygiene products, including soaps and hand sanitizers, that are available in easy-to-use, convenient packaging and dispensing systems designed to make the products easy and accessible for people to use. But we do more than just provide the products. We have a full assortment of cleaning procedures, cleaning tools and equipment, as well as training procedures to ensure that your teams are able to use the products properly and perform their cleaning and disinfecting tasks both effectively and efficiently. In addition to training on cleaning procedures, we also offer general educational materials such as the Catch It, Can It, Clean It poster that we showed, and other materials that could be used within your facility. And lastly, our personally delivered service. We've got the largest sales and service organization in the country, so our teams are ready and able to work with you in your facilities to help them ensure that our flu prevention solutions are being leveraged in the optimum manner. We also provide educational resources through our website. So you can find these additional information sources on the ecolab.com website, our flupreventionmatters.com website, and I'd really like to call out that one as a good starting point for general flu facts as well as information on some of our solution offerings. You can see the two links here for some of our hand hygiene and disinfectant products. And then I want to call out our virus primers. On this website listing our virus primers, we have information on influenza, but also on other organisms that might be of concern to you, such as measles, norovirus, and others. This is an area of our website that John works very, very hard to keep updated and current to ensure that we're providing information on organisms that may be of interest to you. And lastly, any webinar on the flu wouldn't be complete without a reference to the CDC website as a resource. And this is a resource that we'd encourage all of you to look to for public health-related information. The CDC site provides a wealth of information related to flu, including the status of the current flu season, as well as additional tips for prevention. And we've listed two links here. The first is for the CDC flu season site for the season we're entering right now. And the second is specifically targeted to long-term care employers. We know that several of you on the call represent long-term care facilities, and we wanted to make sure to make you aware of this toolkit for you to use within your facilities. And so with that, we've now reached the end of our webinar, and we'll open the floor to questions. And as a reminder, to ask a question, please use the Q&A panel located in the lower right-hand side of your screen to type in your question.
So this is John Hanlon. I'm seeing the first of what looks like several questions coming in. And Hank, if you don't mind, I'll just read out the first question that I'm seeing here. And let me just make sure I can read it properly. Question number one, Hank, are all disinfectants the same?
Thank you for that question. No, all disinfectants are not the same. As we mentioned, there are some key things that you want to be certain to look for. You want to make sure that the product has an EPA registration number. You want to make sure that that number is clearly listed on the label. Again, in the United States, it's the U.S. EPA that registers and certifies all disinfectant products. Additionally, you want to make sure that it has a claim against influenza. Not all products will have that claim. And you also want to look at the contact time that's listed on the label. Many products, in fact, most products take as long as 10 minutes to provide that disinfectant efficacy, but there are newer products out there that are as fast as 3 minutes or even shorter. So again, I can't emphasize it enough. Be sure to read that product label. And now I'll go ahead and I'll read the next question here that we have. And this one I'll direct to you, John. Does the hand soap you use have to be an antibacterial hand soap?
So good question, very good question, in fact. So with respect to viral infections, the answer is no. Regular soap and water will be effective in removing viral organisms. Antibacterial soaps are designed to be effective against bacteria. And as you've heard over the last 45 minutes or so, we're talking about a viral infections. So no, antibacterial soaps are not required for removal of viral particles. Another question that we have, and I'll take this, Hank, and also answer it. If I want more information on flu beyond ecolab.com, where should I go? So Hank showed a slide. We highly recommend, highly encourage CDC.gov. I may be one of the CDC.gov's heaviest users, but it is a phenomenal website, not just for influenza virus, but for all viruses and all bacterial infections, as well as non-infectious disease information. With respect to influenza, if you go into cdc.gov, right at the top, you'll see health topics. It's alphabetized. Click on I for influenza, scroll down, and you'll see links to information on seasonal flu, which we've been talking about over the last 30 to 40 minutes. You'll find information on avian influenza, swine flu, as well as pandemic preparedness. So Hank had a slide, so again, I recommend cdc.gov.
Thanks. I'll take the next one here, John. The question is, what type of follow-up would you suggest for those team members who feel that they must be there all the time? So it can be difficult. Oftentimes we talk about the problem being employees who don't show up to work. But in flu season, those really dedicated employees who feel they have to be there all the time, even when they're sick, they present a different type of problem. And I think the best thing that you can do with these individuals is really educate them on the impact of what can happen when they come to work sick, the impact on their coworkers, but not only on their coworkers, also on the people in and around the facility. For example, if you're a building service contractor, building service cleaning company, and you're cleaning schools or cleaning office buildings, that sick employee has the potential to spread that flu virus to the people who are going to be coming in and using that building the next day. So really emphasize to those employees, hey, I understand, I appreciate your dedication, but here's what we're trying to prevent. We're trying to prevent you getting other people sick. And so get them to look at it not as what they're doing for themselves by being at work, but get them to look at it as the impact they could have on others, big picture.
The next question, and I'll read it out and ask you to answer it, Hank. We've talked about hand washing. We've talked about soap and water. We've talked about antibacterial. Sorry, I just got to read the second line here. How do I make hand sanitizer best available to the people in my facility?
That's a very good question. If you're going to use an alcohol-based hand rub in your facility, as we mentioned before, if you make it available to people, easily available to people, they're more likely to use it. And there's a couple of different ways. You can provide personal size containers that they can have with them. You can also look at tabletop packages, things that you can put in communal areas like break rooms, if you're in an office building, by where they have the microwaves or refrigerators where people can get easy access to it. And also companies, including Ecolab, we do have sanitizer stations that are portable dispenser stands that can be put at entryways, as you're walking in towards your elevators. And at least in the case of the ones that we offer, you can put customized graphics in there to promote your hand hygiene message that you want for your people, your hand hygiene or your flu prevention message.
We've got another question, and that is, you mentioned cleaning and disinfection of surfaces. Do I have to clean everything?
Do you have to clean everything? I'm hesitant to say no, but what I will say is you want to focus on cleaning those high-touch surfaces, those objects that are most likely to be contacted by people. Because again, we're talking about the flu being transmitted through surfaces. When people touch those surfaces, pick up the virus on their hands, and then touch their eyes, their nose, or their mouth. So you want to focus on things that people are likely to touch. Things like doorknobs, push bars on doors, elevator buttons, light switches, stair railings, the buttons on the microwave in the break area. Think about the things that you touch every day when you're walking through your facility, and that's probably a pretty good list of the things that you need to be cleaning and disinfecting with a higher frequency.
Another question that we've got is, I've seen the expression flu season in the Northern Hemisphere. What exactly does that mean? I'll take that one, Hank. So basically, flu season in the Northern Hemisphere, which includes, for the most part, the U.S., Canada, Europe, and other countries above the equator, flu season is typically what we know as our winter months. So that's that October through April-ish time frame. You flip that over, and flu season in the Southern Hemisphere is that June, July, May time frame through October, November. So in the Southern Hemisphere, they're actually coming out of their flu season. Good question.
Good. So with that, we're not seeing any additional questions coming in. We've gone through the ones that were in the list so far. If you have a question, I would encourage you to type it in very quickly. And not seeing any additional questions come in. With that, on behalf of John and myself, as well as everyone here at Ecolab, we'd like to thank you all for joining us today. And just to remind you that we're here to support you in your operations, and if you require any support, please reach out to your Ecolab representative, or you can reach Ecolab at 1-800-35-CLEAN. That's 1-800-3525-326. And if you'd like any additional information on anything you've heard in the webinar, or you want to reach John or myself for another topic, our email addresses are listed here. And as a reminder, at the end of this webinar, the survey form will pop up on your screen. Please take the time to complete the survey, as we really do value your feedback, and it's going to help us improve for future webinars. So with that, thank you all for attending today's webinar, and we hope that the information we shared has been helpful to you and will be helpful to your organizations. Thank you.